Signs of vitamin D deficiency. Would you be aware of vitamin D deficiency symptoms? Although the indications and symptoms of low vitamin D levels might differ from person to person, the telltale symptoms often include weakness, poor bone health, and excessive weariness. However, vitamin D insufficiency can present itself in a variety of ways, and it's normally determined by a blood test rather than by symptoms. Continue reading to learn 14 symptoms of vitamin D insufficiency that you may be experiencing, paying special attention if you have a higher chance of having low vitamin D levels. People over 65, those with darker skin or a malabsorption problem like celiac disease, as well as those who get minimal sun exposure, are at a higher risk of vitamin D insufficiency. Depression vitamin D deficiency may raise the likelihood of developing depression or make an existing case worse, according to research on depression. Seasonal affective disorder, SAD, and low vitamin D levels are also believed to be related. If you've seen any signs of depression or seasonal affective disorder, such as a protracted period of sadness or a loss of interest in routine tasks, you should seek medical assistance from your GPI. Even though depression can be serious and shouldn't be attempted on your own, taking a vitamin D supplement may be of use in the long term. Tiredness and fatigue. Does a vitamin D deficiency make you tired? Yes. Research has shown a connection between vitamin D insufficiency and fatigue, demonstrating that those with low levels of vitamin D can see an improvement in their exhaustion when taking vitamin D supplements regularly. Make an appointment with your doctor to get a blood test done to see whether your vitamin levels are low if you have unexplained exhaustion. Weariness and exhaustion. Does a lack of vitamin D make you tired? Yes, studies have linked a lack of vitamin D to weariness, showing that persons with low levels of vitamin D might experience less exhaustion when routinely taking vitamin D pills. If you have inexplicable fatigue, schedule an appointment with your doctor to have a blood test performed to determine whether your vitamin D levels are low. Back pain, back discomfort may come from a vitamin D deficiency since vitamin D supports bone health. Additionally, vitamin D has been demonstrated to have some anti-inflammatory advantages and may lessen muscular pain following exercise. Therefore, if you're not sure why your back has been hurting, think about taking a vitamin D pill on a daily basis to see if you get any relief. Hair fall. Many other conditions, including a vitamin D deficiency, can lead to hair loss. In fact, a recent study discovered a possible connection between low vitamin D levels and the severity of androgenetic alopecia in men, male pattern baldness. Making sure we're getting the proper amounts of critical vitamins and minerals, like vitamin D, is crucial for maintaining thick, luscious hair since beauty comes from within. Weight gain. Some studies have found that people who are overweight or obese tend to have lower levels of vitamin D, leading to suggestions that low vitamin D could cause weight gain. The evidence for this, however, is limited. Weight gain occurs when you eat more calories than you burn, and the only way to lose weight is by burning more calories than you're eating. That said, taking a vitamin D supplement is great for your overall health, so there's no harm in seeing if this helps your weight management. Anxiety. One of the most prevalent mental health issues is anxiety, which affects over 8 million individuals in the UK at any given moment. One study indicated that taking a vitamin D supplement may reduce anxiety. Researchers have discovered a possible connection between a lack of vitamin D and anxiety. Everyone occasionally feels anxious, but if your anxiety is worse than usual or is significantly depleting your quality of life, you should see your doctor. Decreased wound healing. Have you noticed that minor wounds and grazes are healing slowly? You could have a vitamin D deficiency. Low vitamin D levels have been linked in a research to difficult to heal wounds. Consult your doctor if you have a wound that is not healing. Although a vitamin D deficit could be to blame, it's wise to avoid jumping to conclusions. Another sign of an infection, poor circulation, or even diabetes is a slow healing wound. Dry skin conditions, according to research, those who are vitamin D deficient are more likely to have dry skin that is also more prone to eczema and psoriasis. This may be related to a possible relationship between vitamin D and skin hydration. Research indicates that those with low vitamin D levels had skin that is on average drier than individuals with normal vitamin D levels. Since eczema and psoriasis are frequent skin disorders and many people have dry skin in the fall and winter, vitamin D insufficiency may not be the sole cause of these problems. Consult your doctor for a blood test or think about taking a vitamin D supplement if you're worried about your dry skin and think you may have low vitamin D levels. Increase in infections or diseases. Vitamin D is one of several vitamins and minerals that are known to support the immune system's normal operation. It is believed to lower the inflammatory response of white blood cells and increase the immune cell's production of infection-fighting proteins. Your immune system might not be functioning at its optimum if you lack vitamin D. This implies that you could become sick more frequently than normal and get diseases like the flu or the common cold. Cognitive impairment in older adults at 70 years old compared to 20 years old. Our skin becomes thinner as we age, and it loses more than 50% of its capacity to synthesize vitamin D. Our blood arteries remain healthy thanks to vitamin D, which also guarantees that blood-carrying nutrients reaches our brain cells. Dementia has been related to low vitamin D levels. One study identified a relationship between low vitamin D and a higher risk of both dementia and stroke. Research into the causes of dementia is ongoing, but daily vitamin D supplementation may help to prevent or delay cognitive decline as you age. Muscle pain as we age. Many of us have persistent muscular discomfort and weakening, which can be difficult to diagnose as a cause. As we age, our vitamin D levels also often decline. There may be a connection between a vitamin D deficit and chronic pain, according to the evidence. In fact, one study indicated that children's developing pains were substantially less severe when vitamin D pills were used. Try taking a vitamin D pill for a few weeks to see if there is any relief if you've encountered inexplicable muscular discomfort. This video has come to a close. Thank you so much for watching, and if you enjoyed this video, make sure you click down below